Thanks for joining us. We're proud to offer regenerative pain medicine training, ultrasound workshops for regional anesthesia and interventional pain, online training as well, and board prep for pain docs, anesthesiologists, physiatrists. Check out the Virtual Pain Fellowship if you're interested in learning more about pain management, getting trained online for ultrasound-guided interventions, regenerative pain medicine therapies, as well as our extensive question bank. It's the ultimate resource for pain management board prep. I mentioned my patient with the plantar fascia and the Achilles tendon, how they did great with a PRP shot. Many retrospective studies suggest the advantage of using PRP. The higher levels of evidence do not support the significant efficacy. Okay, so keep that in mind. Of course, it depends on whose study you read because you'll find different things. Large randomized controlled trial by Key found no evidence that PRP improved muscle function tendon. They hypothesized benefits of PRP plasma and tendon injury healing based on encouraging findings. Lab studies did not translate to this. Is a pretty negative study that these guys are quoting. Effects of PRP in ruptured Achilles tendon. Well, I never use it for ruptured, but I'd send them to surgery. But locally applied PRP enhanced maturity of the healing tendon tissue by promoting better collagen 1 deposition, decreased cellularity, and higher glycosamine content when compared to controlled samples. You can look at the study yourself. Here, Achilles tendon regeneration's randomized controlled trial with PRP did have a benefit for the Achilles tendon rupture and VISA outcome functional scores. 4 patients had fuse performed, which is functional ultrasound and elastography, showing bigger and harder tendons resulting compared to the other pending results from the other study. Okay. High volume injection of PRP and sham treatment in chronic mid-portion Achilles tendinopathy, level 1 evidence. 16 men. They found treatment with the high volume injection or PRP in combination with eccentric training in chronic Achilles tendinopathy more effective in reducing pain, improving activity level, and reducing tendon thickness and intratendinous vascularity than eccentric training alone. High volume injection may be more effective in improving outcomes than the PRP in the short-term study. It was evaluated only until 24 weeks, so we don't know what happened beyond that. As you can see here, there are meta-analyses performed with conclusions that there's no clear additional benefit to using PRP. I encourage you to look at the studies yourself. One could argue that it's a meta-analysis and some of the PRP may not have a platelet count as high as the PRP that we're using clinically. But that being said, I'm still offering it to my patients at this point in time because many patients have failed steroid therapy and the benefit has shown to outweigh the risk anecdotally in my practice, and I'm having pretty good results. So when it comes to PRP, in conclusion, really be mindful of the type of PRP you're using. Explain the risk benefits and evidence to patients and encourage them to look it up on their own and tell them honestly if the evidence is there or not and how strong that evidence is. In some cases it's not so strong as we noted here. However, it's probably a safer therapy than steroids, and it's a nice alternative for people who want a more natural type of injection which may have a chance of giving longer term pain relief. The jury's still out for a lot of things, and I think the future will clarify with further studies the role of PRP in the management of chronic pain. But for now, I think it's probably a very safe and ethical choice for patients, even if the evidence is not so strong, because it's what I would offer my relative as well as myself. I've done this on myself numerous times. So I'm still a big fan of it. If you're interested in coming to one of my courses, go to nrappain.org or painexam.com. Or if you're interested in visiting my office as a patient, please call 718-436-7246 or 516-482-7246. Thank you and good luck.